stroke occurs when blood flow to the brain comes to a sudden halt, depriving the organ of oxygen and nutrients. Well-established risk factors for having a stroke include high blood pressure and high cholesterol. But research has pointed to other less modifiable conditions as being influential on the risk of stroke too. One mental health condition that is rife in the UK could heighten the risk of the condition threefold for hundreds of thousands. Faster hospital treatment, clot-busting drugs and longer-term rehabilitation are believed to be driving down rates of stroke in some parts of the country. But the UK has continued to run nationwide campaigns to raise awareness of the sign of stroke in the past decade, in a bid to lessen the risk of death. Symptoms typically include sudden difficulty with speech, lopsidedness in the face, and numbness in one side of the body. Those who receive emergency care within the first 4 hours of the symptoms appearing are more likely to receive curative treatment. B12 deficiency, the sign of dangerously low levels that mimics Parkinson's disease. Existing treatments typically target the blood clot before the patient undergoes surgery when it is completely destroyed. Losing weight, and managing blood pressure are some of the best preventive measures to avert the condition. Other research however suggests that mental conditions such as obsessive-compulsive disorder could also be influential on the risk of having a stroke. A study published in the American Heart Association suggested that people with OCD were 3 times more likely to suffer a stroke caused by a blood clot, compared to those without the condition. Don't miss, Bradley Walsh Health, star warned by doctors of silent killer, latest, Omicron variant symptoms, the sign appearing when eating, Informer, Gordon Ramsay Health, chef scared to slow down after diagnosis, latest, Dr. Yamei Bay, the study's senior author said, the results of our study should encourage people with OCD to maintain a healthy lifestyle, such as quitting or not smoking, getting regular physical activity and managing a healthy weight to avoid stroke-related risk factors. For their study, the researchers compared stroke risk between roughly 28,000 adults with OCD and another 28,000 controls over a period of 11 years. Findings revealed that the risk was highest among people over the age of 60. Dr. Bay continued, more research is needed to understand how the mental processes connected to OCD may increase the risk of ischemic stroke. For decades, studies have found a relationship between stroke first and OCD later. Our findings remind clinicians to closely monitor blood pressure and lipid profiles, which are known to be related to stroke in patients with OCD. The NHS defines obsessive-compulsive disorder as a common mental health condition where a person has obsessive thoughts and compulsive behaviors. OCD can affect men, women and children. Some people start having symptoms early, often around puberty, but it usually starts during early adulthood. OCD can be distressing and significantly interfere with your life, but treatment can help you keep it under control. Symptoms include an impulsive tendency to replay an unpleasant thought, image or urge in your mind, despite it triggering feelings of anxiety. Repetitive behaviors may arise as a result, as a means of relieving unpleasant feelings brought on by obsessive thought. How to avoid stroke. Having high cholesterol, atrial fibrillation, and diabetes can all predispose individuals to stroke. Measures to lower the risk of stroke include exercising, eating healthy, consuming less sodium and alcohol,